And as we always do, we stand and do the pledge to the flag. Those that can, okay.
Pledge allegiance to the flag
To the flag
of the United States of
States
America,
of to the republic, which stands
one nation, under God, justice.
one nation,
and justice.
under God, indivisible, with liberty and justice.
Thank you. Thank you. Before we all sit down and get too comfortable, and if you do not want to participate in this, it's up to you. To me, it's an honor and it's a sad occasion that I think that as this community grows and we see the diversity in our community, and since this is a part of our history, I think that we should take a moment and just have a moment of silence for Congressman John Lewis. And as we remember Congressman Lewis and all that he stood for, let's not forget C.T. Vivian and his contributions. So if you would like to, I would appreciate it if we would just take a few moments of silence to remember these two warriors. Thank you all so very much. Now, Kate, could you do roll call so I'll know who's here, board members, so we can have it on record?
Yes, of course. Give me just 1 second here. Sorry. Okay, I've got Joseph Britton, please.
Present.
Rachel Chalesky,
Here.
Kate Canetta, present. Gladys Cooper,
Here.
Lauren Daly,
Here.
Joe De Silva is absent this evening. Catherine Hodgson, also absent this evening. Richard Janelli,
Here.
Kathy Molinaro,
Here.
Al Russo,
Here.
Amy Spallino.
Here.
So 9 present, 2 absent.
Thank you, Kate. Just some house cleaning. Some of you that was on earlier, if you have any questions, we will ask you to do your question through the chat box. And as Kara has stated early, Dr. Mead will be checking in with the check box and to go over the questions or put them before the superintendent or whoever he has designated. We will ask you to have your phone and microphone muted. Only the Board of Ed members are to have your phones, your microphones unmuted. So at this time, we know we have our superintendent here. I'm going to turn this part of the workshop over to our superintendent.
Thank you, Gladys, very much for this night and to come together and have dialogue regarding the plan. I have my team here, the cabinet's here. I did mention that Representative Conte and Senator Kushner and Brennan, I think, will be joining us. I don't know if others, I see city council members on. I know the mayor is on as well. So we have a few things I'd like to begin with. So would you please bring up the presentation? What I'm going to ask the board, what we've tried to do is we've talked about the plan a number of times and we've sent it out, but there's some things, the narrative around the plan that I think is relevant for you to know and be thinking about. I'm going to ask you patience because this plan has changed even today. We get information from the State Department. We get best practices that are changed and we make adjustments. We will try to dispel rumors as they come through, but there are things that may be said on Monday and Monday evening, they are changed. Very true. So two things I want to express to you that I've come around to understanding that next year, the assurances I have that regarding teaching and learning is that we're going to have distance learning as a given, whichever system that we're on. And if we bring students in my view, that'll be a luxury, given the uncertainty of everything that's happening. I'm not an epidemiologist. I read what all of them are saying. Well, I'm coming down on the best practices and things that we were able to operationalize in our plan. The recommendations from the state are put forward as guidelines, and they have a qualifier that says, for example, on the social distancing, if you can achieve it. Well, we're working on that, but you will see tonight there are so many more things to what we're doing than the distancing regarding safety, and it's important for parents, the board, and the city to know that our due diligence is being done. I said a month ago, I'm going to focus on safety. And because of that, I will go on right now telling you that I've ridden the state with support from the mayor and from this board, and I thank you just twice, actually. Most recently, you want to bring up the second letter for me, Kevin, my preference is that we start in the hybrid model. I think the state has required us as a district, has required you as a board to follow the code as you're sworn to do, and I am sworn to do, and we will do that. We have 3 phases to our plan. My preference, I will make no bones about it, is the hybrid model. And I feel it's a model that would present itself in a way that I can create a better and safer atmosphere for all our students. The phase 1, as in my letter here to the governor, is one that we put forward, and it's going to require much adjustments that we will talk about this evening. If you look at my 5 points about safeguarding the health and safety of students and staff, allowing students the opportunity to return to school full-time starting in the fall, that is what we're asked to do. And with that, I say to you, we are returning in the fall. It is the everyday thing that I'm having some real angst about. So I want to put that as the backdrop. And I do want you to know that I've been working diligently with the mayor. He has been working with the city medical advisor. I've been working with our medical advisor, and we will update you with some information regarding that as we send our plan to the state. We are going to attach an addendum that I think would be helpful in supporting our case for starting in phase 2. You want to roll that through a little bit for me? The re-entry plan is extremely expensive, and Courtney's going to go through it. You're going to see half as much of the money that we could have spent. We've had to prioritize focusing on the things that I've talked about in terms of distance learning, safety, cleanliness, things that when we listen to the various groups Kevin's going to bring up as they gave us input, they are very high priorities for us.
I got it, Mary.
We've attempted to achieve that in a manner that was reasonable, in a manner that we could afford to do. But in actuality, the need and the wants far exceed what we think we need to do totally if we would achieve everything that the guidelines request us to do. We're fulfilling them, but as best as possible with that standard. So you want to move through the letter and go to the next phase? Mayor Boughton, I'm going to ask you at this point if you'd like to comment regarding set the stage a little bit about what we've been doing.
Sure, absolutely. Thank you, Dr. Sal. So we really engage our health department and our medical advisor and Dr. Fong to be able to talk a little bit more about what is available under the governor's executive order and what steps that we can take to make sure that our children are safe and secure. And particularly, obviously, in some of our buildings that there are just a lot of kids there. And so we've had several meetings about this. Today's meeting, we sort of came up with a strategy that along with our reopening plan, we would add in a letter from our doctors that are very direct, saying, look, we don't, I'm shortening it, but basically says, look, we just don't think it's safe to send our kids back to school under a full opening, plan, that the hybrid plan would be the best approach. I don't see a bureaucrat up there that's going to want to overrule a doctor, a medical doctor, for the simple fact that, God forbid, we have an outbreak or a community spread going on in one of the schools. We're going to hold people accountable. I'm going to hold people accountable. And I'm going to hold people accountable that ignore our request that's very rational, reasonable, and safe that's been put forward. So we think that that is a very powerful message to be able to send to those individuals that are making this decision. We certainly understand and applaud their enthusiasm to get our kids back to school as fast as possible. I think all of us agree that there's such incredible value in being in a classroom. As a former teacher, I can tell you that the classroom experience is really why we have schools. But we also, we have a responsibility to protect the health, safety, and welfare of our children and our residents. And opening at a full opening plan will, I believe, jeopardize the health, safety, and welfare of our students and all of our residents, not just the kids, but also the parents, the staff members, everybody. So we think that this will give us a significant amount of leverage in being able to convince the state that, Danbury is unique in many ways, not unique in other ways, but unique in certainly the amount of students we have, and that we really need consideration of this approach. There are certainly some schools out there. I think of Chippewa High School it's about half full, right? It's built for 800 and there's about 400 kids in there. They can go to a full opening because they have enough space to offer 6 feet between every child. We just don't have that at Danbury High School, and we don't have that at our middle schools. Don't have
some
that
elementaries.
in our elementary schools. So we believe that this would make the most sense for everybody. It's a burden to some extent to parents. We understand that. We have a custodial care duty here as much as we have education. But at the end of the day, it's my responsibility. I took an oath to protect the health, safety, and welfare for all people in the city. You all did as well. And I just am very passionate that this approach is the best way. Now, January, we can reevaluate it. If it seems like, we've kept on this downward trajectory, then that's what we'll do. I will tell you that our numbers have been bumping along at about 1 or 2 new infections per day. We get a death every 3 or 4 days, tragically, horribly. So it's not completely wiped out. It is out there, and it's just a matter of putting people in the right proximity to other people to begin a new spread of infection. So I think that Dr. Sal, the board, the medical team has done the right thing here. We're doing everything we can to talk to everybody we can up there. We encourage our legislators to help us with that by reaching out to the commissioner and to the governor's staff and saying that we think this is the right approach. But tough times, but I think we'll get through it.
So phase 1, phase 2, my conversation with everyone that I'm speaking to has to do with our size, and we have to make accommodations to make it work. Things that we have to create during a school day to allow the youngsters to attend if we are to start in phase 1. But that being as it is, I wanted Kevin to go through and let the community know, and the 163 participants, and we have about another 100 and plus on the TV, that what all went through here. This doesn't mean that everybody agreed to all of this. All this is input that we've received. So go ahead, Kevin.
Want to see the other letter?
No, just go ahead and go to the first phase. Go to the participants.
These are the participants here.
Yes. Do you want to talk about them so we can do that? The engagement committees.
Right. Well, this is just a thanking the committees. At the top are the committees, many of them officials of the city, and then a lot of the folks are also district staff members. So we just want to express our appreciation to this group And then the group down below are additional staff members and district staff members who we had asked for additional help, asked for their expertise and feedback on, and we would just want to take this opportunity to express our appreciation for them as well.
All right, you want to roll through it and start the presentation then?
Okay. All right.
Go ahead. The state
So-
priorities.
So the state has identified priorities for every district that is going to submit a plan. Starting with every school district is required to have 180 days and 900 hours of instruction. In our case, most recently, as recent as this week, we got final word that it has been approved at the state level that schools can also elect to have 177 days and 885 days of instruction.
Hours.
Hours, if the board decides to avail itself of the 180-day rule. There's also, the state also requires, is one of their 3 big priorities, is that we have a plan in place for in-school instruction for all students on a full-time basis, a plan to provide both in-person and remote learning support options, and this is what we're calling our hybrid model. And then last but not least, a plan for total distance learning in the event there's a significant resurgence of COVID-19 in our community. The state recently, as this week, submitted correspondence that stated that any plan that is submitted to the department this week that does not include a full reopening option as one of the 3 models will not be in compliance with the expectation. And so to help further inform the development of our plan, a lot of folks on this call are certainly aware that we have elicited feedback of our community through our thought exchange, which I'll talk about a little further. Our district surveys, we sent out our first survey right after the state plan was released. And then we just released another survey yesterday in which we have almost 1,800 participants already. We've also had several town hall meetings, 2 with our administrators specifically to this issue, reopening, 2 with our teachers and staff, 1 with students, and then 2 town hall meetings also with our parents and community, family and community. And then of course we had a Board of Ed meeting specifically for reopening as well. Families, most recently in the last 2 surveys, were asked to select their child's program of choice, which we will speak to throughout this presentation. And families and staff in the thought exchange in town hall meetings were asked their highest priority for reopening schools. And so our initial survey in July, and I'll give you some preliminary data for our survey that was just released yesterday. And in that feedback from the survey, we learned earlier in July that 73% of our respondents would plan to have their children return to school if we would have to full in-person learning. At the time, again, this is when the state's plan was first released, 52% of our families responded that their child would plan to ride the bus. 64%, when asked if you would choose a hybrid model if it was offered, 64% of our families said that they would select that model. And last but not least, if offered, 51% of our families said that they would choose an exclusive distance learning to start the 2021 school year. Our town hall feedback, as you might imagine, and a lot of people again on this call who are watching have been part of the town hall feedback sessions. Just a summary, we did have 7 engagement sessions in total. And needless to say, health and safety was the primary focus of those meetings. There were several questions about supplying staff and students with PPE. There were also questions, particularly as we got closer and closer to our presentations, if in this hybrid AB model, would there be opportunities for siblings to come to school together regardless of grade levels? So we will have an opportunity to talk about that later on as well. Staff and families expressed concerns about our ventilation systems, no fans in the classrooms, et cetera. And so Courtney is going to talk about that a little bit and how we're going to help mitigate those issues. There were a number of questions about the process for suspected COVID-19 cases, and at the same time, who's going to deep clean and or disinfect our schools. And so I think the community is going to be very happy to hear that we have plans for all of those areas. Plan for extracurricular activities. In one of our town hall sessions, one of the several students in that breakout session talked about the importance of maintaining extracurricular activities, and that it was important for them and a priority for them that we ensure that they still had a high school experience and middle school experience. And so we will be talking about that throughout the presentation as well. Implementing safety drills without congregating. And so that is still something we're exploring to figure out how we're going to make this happen. A plan for high-risk staff and students. And so you're going to hear a plan about staff as we go through the presentation. And then staff, how to enforce the wearing of masks, training of staff, and that we'll be talking about when talking about our district calendar, reliable internet access for families, who will sanitize the rooms in between uses, student sharing materials and health concerns for students riding the bus are all prominent issues that were raised in our meetings. And for the most part, in this presentation this evening, you're going to hear responses and how we plan to attack those. The thought exchange feedback was 398 total participants, but there were 8,650 items rated. And in what you see in this slide are the top rated thoughts that I was able to include anyway for this PowerPoint. But again, this group will not be surprised to hear that the health of all students and staff was the most important consideration. Teachers particularly were concerned about class sizes being too large to be able to social distance. And so Courtney is certainly going to talk about that, and I'll work with an architect to come up with a plan to make sure we can address the social distance guidelines. Specific questions about vulnerable staff. And so we will be speaking to that later on in the slide with our HR department, with Kim Thompson. And we must have resources to protect staff and students, otherwise we should not open for in-person learning. And I think this evening you heard Dr. Sal and our mayor speak to this issue, and I think we've heard the community loud and clear. Hence, the two letters that have already been submitted to the state, and another letter that's going to further support the idea of coming in a hybrid model. Something that we're also preparing for, and that is supporting our students and staff with social emotional support. And again, in the thought exchange, this is one of our highest rated items. And last but not least, additional staff for cleaning and disinfecting classrooms and other areas of the building. And you're also going to hear later on in the presentation on how we plan to address those items and those concerns. And so there are, as part of the requirements from the state for a plan that's to be submitted, there are certain sections that are required in every single plan. And so we've tried to align our plan with the state's expectation. And so the categories are as follows: facilities and operations, transportation and food services, health and wellness, academic experiences for students, staff, and families, training for staff to help open up the year safely, and provide social and training around social emotional support for staff and students. Technology, so the ability and the assurances that we can provide one-to-one devices for all of our children, and help support families that need support with connectivity, specifically in social emotional support, before and after school care. So Dr. Mead is going to speak to those areas, also as family school partnerships, and then we will close out the sections required in a plan with Chip Salvestrini with extracurricular activities. There have been a flurry of questions and clarifications needed, and Chip has been gracious enough to join us this evening to help present. And so the first person to present this evening is Courtney from Director of Finance and Operations. And Courtney, we're ready for you.
Thanks, Kevin. Hi, everyone. At first, I just wanted to say thank you, a big thank you to the mayor, the legislators, the board, the medical staff that we've worked with, and all the administrators and teachers that got us to the place where we are in the plan. And as you'll see, we still have a ways to go, and we have a lot in place that we're going to talk to you about tonight. But I want to say first, thank you so much to everybody that's contributed to what we have so far. Kevin, I don't know if I have the ability to advance. Oh, okay, thank you. So So the first thing we wanted to talk to you about is the resources that we've dedicated. As Dr. Sal said, it's not enough, but we've prioritized with the resources that we do have. We've dedicated about $5.2 million, of which that's the Federal CARES Act funding. You can see the sources on the bottom. We spoke to the board and to the public about a braided funding approach for this fiscal year. This is a subset of that braided funding that is allowing us to safely return students to school within the guidelines. And what we've done is so it's the CARES funding. This is the federal ESSR money that we're talked with the board about earlier. There's a city fund, so we've partnered with the city to utilize some of our reserve for some of the things that we needed to do. And we're utilizing some grant carryover funds from this year from our state alliance and Title I grants. So what are we purchasing? This has been a work in progress with a lot of people involved, including the director of curriculum, the director of technology, director of safety. We've worked with the city and with our nursing supervisor, as well as our director of special ed and HR. So what we currently are dedicating in resources is about $3 million to online instruction and distance learning. Included a big purchase of one-to-one for Chromebooks, software that we need and needed to get in place last year to get students to be able to work remotely to do their distance learning from home, and additional investments that Dr. Kara Casimiro is going to talk to you about shortly, in addition to student support specialists and an SRBI tech admin in order to integrate the curricular modes, given that some kids will be in distance and potentially will be in a hybrid model. Additionally, we're looking at purchasing a lot of sanitizer, sanitizing stations, disinfectant, funding set aside for deep cleaning, as well as Dr. Sal's asked that we add a custodian to every building, at least, and in some places more than one, so that we can focus on sanitizing all the touch points and really our big priority is keeping the space clean. Facilities as safety, we're purchasing protective shields for desks, where, for example, in the K through 2, if we have circular round tables, or if we have rectangular tables, we need to put shields on the tables so that the kids are separated. In addition, protective shields for any interactive points with the public, as well as signage, which I'm going to show you. We've engaged with an architect that took 3 sample schools and walked through from start to finish everything that's a recommendation based on the American Architects Institute, Institute of Architects, applying all of the standards that they come up with for safety with egress and safety within the classrooms. PPE, we worked with we did an assessment. Face coverings are going to be required for every staff member as well as every student. They're going to be required to provide their own face coverings, but we're planning for a certain amount. When kids show up without them or with inadequate coverings, we have them on hand to provide. We're providing all the teachers with face shields in addition to the masks, so that their eyes are covered, and during those face covering breaks, they have additional protection, and a lot of protection for the special ed staff that'll be working directly with our most vulnerable students, such as disposable gowns and additional shields for those children that will allow them. Kelly will talk a little bit more about that, but there's a clear part of the mask so they can read facial expressions, so we're able to have them be able to participate in their learning in the best way possible. In addition, we set aside funding this year because when we fed the families, we were lacking in reimbursement from the federal government, and so we needed to set aside some money from this year's budget for food services. So that's about $5.2 million. This assumes that we can fit everyone in the classes, and that we don't need to buy more teachers or more desks. So this only works, why I mentioned that it's a work in progress is because when we get the results of the survey that we sent out to the parents when they're selecting whether they're going to be full distance learning or in a hybrid model, or we know if we're going to be in a hybrid model, we'll have a sense of the numbers, and we'll be able to say whether we can safely and effectively within the guidelines fit the kids into the classrooms and not have to spread out even further. If we assumed we had 100% all-in model and nobody's remote, this doesn't work because we have about 700 classrooms that have more than 24 students. So why the mayor mentioned that, we're really strongly advocating with the governor and to allow us to start in a model that makes more sense to be able to distance the kids out more.
Courtney, you may want to comment. I think this is appropriate at this time. There are, for example, the high school alone has about 500 classrooms that have more than 24. Now, the mitigating recommendations is when you can't achieve the distancing, given that everything is clean, there's washing of hands, the ventilation, windows open, things of that nature, that the mask provides the safe distance. But when you look at the high school alone, for example, with 500 classrooms in a block, 4 sections, 125 a period, you'd have to probably add 20, 25 teachers and then have the space in order to teach them, which virtually became impossible. The middle school, I see Christian here, it was a few hundred, could have been over that. And then we have the elementary. So, the amount of money that we would have needed would have exceeded $10, $12 million, I think, and that's talking about added buses and many of the things. So what you see here is our best shot to try to create the conditions that we know we could provide within the resources that we have. I'm sorry, Courtney, I just want to make that statement.
Yeah, that's really good, Dr. Sally. Yeah, thank you so much for pointing that out. It's prioritizing with what we have. And the architect that we're working with is making sure that we're spacing the desks out so that, there's a template, and they've gone through, walked through of 3 different types of schools and classrooms. I'm going to show you some examples. So we're literally putting dots on the floor to locate where the desks will go, which is why, right now, today, Kevin mentioned the results of the preliminary results of the survey. Something close to 30% of families might choose distance learning. That would help us spread out the kids in the classrooms in the way that we need to do. Otherwise, it could be another $5 million that we have to go back and ask for. Okay, so should we go to the next
Keep
slide?
going, yeah.
Okay, so on the facility side, we're following the CDC and CSD as well as the American Pediatric Association guidelines, and we're coordinating directly with the school nurse supervisor and the Danbury Director of Public Health Care, Prunty, ensuring that schools meet high cleanliness standards before we even reopen, and we're going to maintain and monitor throughout the year. So we're hiring those additional custodians. We're buying sanitizer for every single classroom. There's going to be a replacement cycle. Throughout the hallways, we're putting sanitizer containers and also hanging wall hangings. There's signage reminding people to wash their hands for 20 seconds, in addition to signage reminding them to sanitize next to the sanitizing station. So planning for and maintaining appropriate social distancing within the classrooms, hallways at the time of arrival, dismissal, and in common areas. We're also working building to building, going in and looking at first the plans, and then doing walkthroughs of all the buildings to put down decals that are going to remind the kids to distance within the hallways. So for example, where a hallway is 10 feet, we're going to have one-way directional where the flow will allow. We're working with the building principals and individuals, dots that are 6 foot apart to remind the kids to be mindful of their distancing. So, that's one piece. We're looking at all of the egress. So every single time a kid makes a movement, and they're mostly going to be in their classrooms and then elementary, middle. But when the buses arrive, we're timing the busing so that the kids are spread out within all the buildings when they enter multiple doors, and they go right to their classrooms, and they're going one-way directional. So, and then the ventilation protocols, we're working with city and facility professionals, and I'll have you advance to the next slide because I'll talk a little bit more specifically about that in just a moment. So I mentioned the building by building facility plan. The architect going into detail at 3 of our schools, 1 elementary, 1 middle, and 1 high school. And then Kevin, myself, Rich Jalbert, our director of facilities, and Kathy O'Dowd, our supervisor of school nurses, and Kelly Churchsis, our director of special ed, are going through building by building, meeting with each individual principal and making plans that comport with what the AIA recommendations are for classroom setup and for egress as well. The lunch distribution I'll get to when I talk about the food, but there's not going to be any kids in the cafeteria. We worked through the recommendations, at least according to the current plan. Things could change because you know, the state hasn't yet issued waivers for the things that we need to do. We anticipate that and are hopeful that they will issue the waivers that we need, but there'll be a point of distribution that will distribute the food to the classroom. And we'll talk a little bit more about that later. We're working on setting up all the isolation rooms because the state requires us to set up an isolation room. Again, it needs to have ventilation. We're hopeful in some cases where there's, for example, specials rooms, now that the specialist teachers are pushing into the classroom, some of those could be utilized as isolation rooms. The high school has already identified a room that's very close proximity to the nursing room now. The building mechanical systems, we've worked with the city to work through how we're going to test and replace filters, and I'll talk a little bit more about that. And we've set up really strict protocols for sanitizing and cleanliness throughout all the buildings. Again, our biggest priority, particularly in response to the community feedback that we got. So facility and operations, the city has agreed to review all the BMS, the building mechanical systems, to ensure efficient operations. This is really important to make sure everything's functioning. They do it normally, but they're going to do it more stringently this summer. They're replacing all of our MERV 8 filters and identifying with Rich Jalbert special conditions to replace with a higher level particulate filter, MERV 13, where they're necessary. And they're going to look at replacing those 3 times this year after the school starts. We have, before school even opens, we're going to operate all ventilation systems at full capacity for 1 week. And we're going to remind administrators about ventilation changes, and they can't make any adjustments without working through the facility director as well as the city facility director. Okay, we can go to the next one. After school opens, now you might have read some of the guidance about ventilation is really important. This is one of our biggest priorities, is to ensure that we have proper airflow. And so we're following the guidelines to flush the air inside the building for a minimum of 2 hours prior to occupancy and then 1 hour after, with the dampers open as fully as possible. And we'll program and lock the fan schedules to align with the schedule of building occupancy. And we're going to keep the ventilation system running during all hours the building is occupied. So this keeps maximum flow. And then at a minimum where the temperature will allow, and we don't have other means of ventilation available, and windows we're saying should be open to allow for a minimum level of fresh air exchange in the open occupied spaces.
I did want to mention this plan be going after school, that we do not intend of renting our facilities.
Yeah, we've sent a memo out to all the partners that we normally do rentals with, that for at least the first 6 months, we will not have any rentals. So that's a loss to the district of revenue, and it's for safety means that we're doing that. Yeah, okay. And we can move to the next. So this is showing the signage. I mentioned us working with the architect. They've identified all the locations throughout the buildings where we would be, it would be good to put these signs. So face covering required before entry at the entrance of every building. You know, there's no visitors. I think if you read through our plan, you'll see that. And even parents, we're setting up tables outside. So a kid forgets something that's entirely necessary, medication or something, there'll be a table outside with a drop-off place for the parent to drop. Parents are not going to be coming into the buildings. We're going to remind children in the students in the hallways to maintain 6-foot social distancing through signage. Okay, we can move to the next one. And then, like I mentioned, the hand cleaning, we're going to just put up signs to remind people, wash hands, prevent spread through hand sanitizer. You're used to seeing these if you're out in the community now. Another thing I mentioned earlier is the floor signs. So where it's allowable, where we're pre-making ourselves and putting on the floor in various parts of the building. So someone asked earlier about a classroom. So this is just showing, you know, the architect was showing us how we would set up with distancing between the desks. So, you know, each room has a certain capacity for what we can fit in terms of desks to be appropriately distanced, and we're going to adhere to that. Okay. And this is just King Street. Here's another example of the classroom setup with distancing. This doesn't look exactly right because this is what our custodians did. So I'll just briefly tell you where we are in the process. All of our custodial staff have gone into all the buildings and moved all the extraneous things to the walls. So whether it's beanbag chairs or rocking chairs or story time places, we're moving all that to the walls. And the first week of August, principals are going to invite certain teachers in to come in and take away items from the classrooms. We're really just going to have desks to encourage the maximum, you know, distancing with the desks, and that's what it's going to be. There's also a 6-foot perimeter around the front of the room, which you can't see here, for the teacher area, and it's a corridor that's going to be set up in each classroom for the teacher to be able to have a bit of room to move but maintain that social distance. And they're also going to have plexi. Well, I don't know if it's called plexi, but face shields that are made of plastic that will be available to them should they choose to use in addition to their face coverings.
Those are face shields.
Yeah, those are the face shields. Mm-hmm. So busing and transportation, you know, Kara's going to talk through the schedule. Busing and transportation is a big consideration for the schedule. We've got to be able to get the kids in and out safely. As you saw on our survey earlier, of the people that are planning to come for in-person, we can estimate that as many as 50% will still be needing to ride the bus. It may be lower when we get the final results of our actual survey, when people are really having to sign up for what they need. But we're requiring face coverings per the guidelines, CDC guidelines, for all students and drivers on the bus. Those drivers are also going to be provided with boxes of masks, disposable masks. So if a student shows up without a mask, we are going to provide it so that they can safely ride the bus. We're intensifying the cleaning protocols between every run, and the windows are going to be open on all the runs. So the kids will have to wear their appropriate clothing, you know, when it's colder out, but the guidance and the recommendation is to keep those windows open. And we're going to be prepared for the increased car traffic. We're training staff, and we're looking to partner with the city to get additional staff for traffic flow and to modify some of what we're doing with traffic flow, like, for example, at the high school. And we're going to work through that with each of the building leaders, principals, about arrival, you know, where we can set up separate place for the bus to come and a separate place for parents to do drop off, we will. And where we can encourage entrance by cohort, we will. Some buildings won't allow for that safely, but we're working through it on a building by building basis. Okay, I think I'm ready for the next one. Oh, and this is just showing a spray down of the bus with an appropriate disinfectant.
Which is done after every run, right?
It's done after every run on all the touch points and at the start of the day and end of the day for the seats. Food service, we're monitoring and following the CSD food service nutrition safety guidelines. We're still being required to offer 5, you know, choices of different types of meal. They're called components. And so because it's going to be of a grab and go nature, we're going to put 4 different things in the bag, and the 5th is the milk, and they can choose the milk. But that way we're going to have the flexibility to have them have a snack during the day. And I'll explain that a little bit more in a moment. And we're going to give additional safety protocol training for cafeteria staff. They've been working through the whole summer. As you know, they've been running food distribution. So they're very, very familiar with mask wearing, keeping the masks on, wearing their gloves. They're very safe at any rate because they're dealing with food, but, you know, they've stepped up all the protocols. And so we're just going to remind them of that and do a couple of run throughs because, you know, one thing I just wanted to mention, we applied for CEP status for the entire district. And if we get approval for that, that means that Danbury High School, AAS, and West Side, we're not going to have to collect rosters or have people sign in digitally, you know, to get their lunches. It will be able to just do a count, and it could be like the other schools that are CEP applicable. So we're eliminating all the touch points. There's not going to be point of sale snacks for the first 6 months. We're not going to be doing that. And we're going to be distributing to the classrooms. Ideally, what the schedule hopes for is a grab and go. So we'll be able to, in the case where we have enough workers, they'll be doing the bringing to the classroom. In the case where we don't, we're going to work through the union to find out who the appropriate staff will be to be act as volunteer helpers to come get the food and bring it to the classrooms. And then ideally, like I said, it'll be in enough time so they can eat a snack if it's a late dismissal. For example, for the elementary, they might not be getting out till 1:35 and they won't be eating in the classroom. And ideally, it will be a grab and go. But that, again, is subject to approval by the state. We've got to get a waiver for that. Yep, and that's my update for the facilities, food, and transportation.
I think, Courtney, the wonderings I would have is why do that? When we looked at the schedules and the number of individuals needed to be spread out for the lunches with the masks off, we thought it presented a real danger for the kids and everyone. So we've had to cohort them differently, and we have to work through that. I think we have to, obviously, this is one-sided right now. We've got to work with the teachers and the other groups to make this thing happen. But ostensibly, we've had to go to this system in order to distribute the food to make it safe.
Yeah, you might hear, to Dr. Sal's point, other schools that are able to eat in the cafeteria. They're smaller schools. After talking with Dan and talking with the middle school principals, we've got 900 in a wave in high school. Those of you that have been there, we've got 330 in a wave in most of the middle schools. And after talking with Kara Prunty and with Kathy O'Dowd, it's just not safe to have that many after we're cohorting in the classrooms in the cafeteria. So, which is why we're looking at doing a grab and go type meal, and we'll still the students will still be getting their full balanced nutritional meal.
All right, it's a quarter of. We got to get moving on this. Health and wellness.
The next section is Kathy and Kim.
Thank you, Kevin. Good evening, everyone. I'll be addressing the topic of supplying of our PPE, the personal protective equipment. So as Courtney had mentioned, per the state guidelines, face coverings are required for all district staff and students. They will be asked to provide their own. Health services will maintain a backup supply in the event that a child doesn't have one, or if the mask becomes soiled during the day, something happens to it, we will have a backup supply. In the event that there is a student who cannot tolerate wearing a mask, and that may be some of our special ed students or some students who have medical conditions, the staff working with those children will be provided with additional PPE, such as face shields and gowns, if that does become necessary. Okay. I'll be communicating with the local health officials when the student or staff member or a member of their household is tested positive for COVID and has possibly exposed others in the school. We will be asking families to, we will be providing a checklist, and we will be asking them, as well as staff, to self-monitor at home. There will be a checklist for certain symptoms, and if they are experiencing not feeling well, they should stay at home. Should we report would come directly to the school nurse that a family member or someone in the household or a student themselves has tested positive for COVID. There's a process in place. That information will go from the school nurse to the principal and to me. I will be notifying Dr. Sal, and then we will immediately, along with our medical advisor, be consulting with Kara Prunty at the health department as to how we will proceed. Okay. I have
Kathy, we lost you.
hear me?
Yes,
Okay, Kevin, can you go back one slide?
sure I can.
Thank you. Okay, so I've been working with Courtney, our Director of Finance, and I can confirm that we will have an adequate supply of protective personal equipment in place for reentry. I have done a cost estimate for her for the entire year as to what I think we will need. I've placed in order that will take us through the first 4 months of the school year. So we will, ensure that all those safety measures are in place. Okay. All right, you can go to the next slide, Kevin. Thank you. Okay. So we are required by the state to identify a supervised isolation room in every building for individuals who have been assessed by the school nurse and determined to have signs or symptoms of COVID-19. The room will serve as a waiting area until the individual can be transported home. So I am working with the building principals, with Rich Jalbert, our director of facilities. We've also discussed it with the architect that we've been working with, and we will be identifying those buildings, and a process will be in place to identify staff members who will supervise until children can be picked up. As part of our sick day guidelines, which parents will receive and will also be posted on our website, it's our expectation that students who are ill will be picked up within 30 minutes. I understand that parents need to work, and I greatly understand those challenges. So they will need to have someone else designated who can come pick up their child in the event that they are ill. Okay. The isolation room will also be utilized by the school nurse in the event that an aerosolizing procedure must be performed. If we have any special needs students who require suctioning or any type of aerosol treatment, we would need to utilize that isolation room as well. The superintendent of the schools has a procedure for the closure of schools for a length of time based on a positive COVID-19 case or cases, and to the risk level within the school community is determined by the local health officials. Again, any suspected case of COVID, we will be sending home. We will be collaborating with the health department, and based on their recommendations, we will determine how we will proceed after that. Okay. And we will be identifying a response team within each school and the district with specific responsibilities in terms of reporting to the school nurse, to me, to the superintendent, as well as identifying staff. We will need to identify more than one staff person who would be responsible for supervising the isolation in the event that someone is out.
Thank you, Kathy.
Sure, next slide. That's all I have.
Kim?
Thank you.
Okay, so from the human resources perspective, obviously one of our greatest challenges is trying to figure out how we're going to align staffing. And part of the reason why the survey is so significant to my group is that as parents make elections and as we try to decide where we're going to assign children or how children are going to be moved through the system, we need to obviously align our staffing accordingly. So that's why the survey asks the kinds of questions it does, so that we can have a better idea in human resources about how we're going to respond. In terms of current employees, what's happening in my office primarily is how to handle those folks who may need to take time because either they have tested positive themselves, or they reside with someone else, or have interacted with someone else who has tested positive for COVID-19. So we are in the process of finalizing training of all of our HR specialists on working on the ins and outs of the Families First Protection Act, which provides specific protections for people in those categories, and so that we can provide support to our employees. In addition, we're engaging in regular communication with all of our employees and our HR teams to explain how a variety of different protections will work. So the Families First Protection Act, the Family Medical Leave Act, collective bargaining agreements that have their own leave provisions in them. Kevin, if you can go back one slide, please. My team is being trained on how all of those pieces will fit together for our existing employees in the event that they need to take time as a result of some sort of either a diagnosis or an interaction with someone who has been diagnosed. For our existing employees, we're finding that it's incredibly important that we provide additional training to them to give them some peace of mind on the safety protocols, how they work. And so over the summer, from the spring and through the summer and into the fall, we're going to continue to push out additional training and support. A lot of it is being done through our employee assistance plan, through our Cigna. They have provided a wide variety of webinars access to personal health and wellness videos and information on how to stay safe. In the fall, during the pre-days immediately prior to the opening of school, we've scheduled some additional training, including a Q&A session with a healthcare provider who can help some of our staff work through things like, what if my mask breaks? How do I respond? So we're trying to create kind of a diversity of training for folks so that they will have some sense of security when they come into work. And that's been something that has been well received and is important for us to continue to convey to our employees. In addition, we have made sure to publicize and encourage use of a telehealth program. So for those of our employees who participate in our Cigna insurance plan, there is a telehealth option available. And Cigna will continue until October to assist in coverage of deductibles for any of our employees who seek testing. So part of our big push is to make sure that everyone understands what's available. For those employees who cannot return to work, that's going to be the lion's share of our work now going forward. We are aware that we have quite a few employees among ours who have serious health conditions that will make it a challenge for them to come back to a full in-person learning environment. So we've been working with union leadership to make sure that the message is out to all of our employees to please connect with either me individually or with a member of my team who's been designated to handle confidential health matters. And we're engaging in a one-on-one discussion with those employees so that we can understand the nature of the serious health condition they present and whether there are reasonable accommodations we can provide to those employees that will allow them to return into work safely and appropriately. There will be a wide variety of individualized reasonable accommodations that we can provide. Right now, the numbers are not huge. We have about 25 employees who've come forward so far. I expect that come August, those numbers are going to continue to increase. And so we'll continue the process of one-on-one dialogue, which is what is not only contemplated by the way that we try to do business in the Danbury Public Schools, but is also required by the law to engage in a dialogue with folks who come forward with a serious health condition. So again, in addition to kind of the regular hiring and processing and onboarding that we're doing right now, it's a significant push for us to make sure that we've provided a sense of security and a conversation with our folks who are concerned about what the ramifications are of returning to work with a serious health condition. So that work is ongoing on my team. And that's all I have.
Thank you, Kim.
Kevin, may I have 2 minutes? Jack.
Dr. Fong?
Yes.
Yes.
Well, I just want to share with the group that the hybrid model actually is the best, the wise model to start the reopening. For the reasons is that that most of us understand that children are not as susceptible or not as severely impacted by the coronavirus. The reality is definitely not the case. A paper published from the Baylor's College of Medicine in the Journal of the American Medical Association, they looked at a 2.5-week period from March the 14th to April the 3rd. During that 2.5-week period, 48 children were admitted to the pediatric intensive care unit in the United States and Canada. So it's only a 2.5-week period. Of those 48 children admitted to the intensive care, meaning they have severe illness as a result of the COVID infection, 17% of them have no known medical conditions. Therefore, it's 83% of children admitted to the intensive care unit have underlying medical conditions such as diabetes, obesity, asthma, and so on, and complex medical situation. So that if we want to provide the best, safe, well environment for all the students, the hybrid model give us the option that they can stay home. I think they can stay home if they can afford it, they can manage it, and return to school when the pandemic is over or when the vaccine is available, or when basically the condition of the coronavirus infection is much, much reduced, or almost, with the herd immunity, maybe you can stop it. So I think is the wise approach with the hybrid model, at least at the beginning. And then we can always modify it as we go along, but that is a wise thing to do. Thank you.
Jack, Dr. Fong is our medical advisor, so I appreciate that. He was one of the advisors as Mayor Boughton was speaking about this prior to at the beginning of the meeting, that we're going to coalesce a letter of which he'll be signing to attest to what he just said. Let's continue with the academic experience, please.
So Kim and Kelly,
Hi.
I'm sorry, Kara and Kelly.
That's
sorry,
okay.
Kara.
Hi,
Let's
this is
go.
Kara Casimir. I'm the Director of Instruction. So I know that folks are very anxious about this part, and so I'm going to try to do my best to kind of clarify some of the differences in the models, the choices that you've made, and then what we were required to put forth to the state of Connecticut. So this slide explains that at Danbury Public Schools, like every school in Connecticut, was required to put forth a model for in-person learning, a potential switch to hybrid learning, and then a distance learning plan. In all phases of the plan, phase 1, 2, and 3, we were required to offer distance learning as an option to families, regardless of the phase. So in the in-person plan, okay, this is a relatively traditional schedule with health and safety guidelines and expectations followed, and teachers and students are coming to school every day. There may be some modifications to the schedule, which you'll see when we walk you through some of the sample schedules. Most of this is to accommodate some of the other factors that we have to deal with, such as having students who are in a distance learning program, and also being able to accommodate busing transportations and some of the increased expectations that we're required to follow by the state of Connecticut. In all phases of the plan, we anticipate making sure that our students maintain digital and blended connections throughout. So when all students come back, we want to make sure that everyone is up and running technologically. They are hooked up to some of our very high quality platforms that we have recently purchased that we will maintain through next year and possibly the next year afterwards, so that should there be a need to switch to a hybrid or distance learning model at a moment's notice, similar to the way that we did in the spring of last year, that we have all of these pieces in place, students are ready to go, and that there is more of a seamless switch over and less disruption as we move forward. Okay, so I just want to make sure that that was very clear. The hybrid model is a model that, again, should we have to move to, would be a 2-day-a-week model, A/B model, 3 days a week of distance learning, with other opportunities for the synchronous instruction. So on the days that students were not in, we would still maintain contact with students. Again, we'll go over what that looks like in more detail in some of the sample schedules that we're putting together now to work through some of this. Again, even in a hybrid, the full distance learning option is still available to parents. Additionally, special education students and bilingual students may have more contact to receive services in this model. Kelly Truchas, who's our Pupil Services Director, can touch upon that a little bit after this slide and before my next one, to give you a sense of what that might look like. And then in a distance learning model, students and parents, because parents are partners in distance learning, engage in distance learning with materials and supports from the school. This could be a blend of synchronous and asynchronous learning. I'll talk a little bit about the fall cohort distance learning group in a second, but should the entire school district shift to distance learning, there'd be an increased expectation for more synchronous live instruction, and some of the components that, based on the feedback from parents, teachers, and students, we know needs to happen in sort of our distance learning 2.0 plan. And I'll talk a little bit about the fall cohort in the next slide when we get to the choices and what that will look like. But I wanted to make sure that there is a distinction between sort of the folks entering in the fall cohort and sort of the overall difference between when we have to shift as a whole district to distance learning, and at that point students will be with their regularly assigned teachers. So Kelly, can you talk a little bit about the special ed piece, and then I'll talk about the choices that folks were asked to make, since there are a lot of questions around that.
Sure. Good evening, everyone. Kelly Truchas, Director of Special Education. I'm going to focus a little bit on the hybrid model. Everything that Dr. Casimiro just went over will apply to students with special education needs. If we were to move to a hybrid model, students with more significant needs, particularly those that are in our self-contained special education programs, as well as some of our bilingual students, it would be a partnership between school and family to determine which of those students would benefit from coming in for additional days under the hybrid model. And that would be determined on an individual basis based on students' individualized needs. And so what we would do is look to offer additional days beyond the 2 in-person days to those particular students and families, again, in conversation and communication with parents to make sure that they were in support of that option, as some of the students have more challenges with accessing and making progress on their IEPs under the distance learning model, particularly those that need more hand-over-hand instruction and things of that nature. So if we were to go to a hybrid model, if you have a student that is in one of the kind of categories that I just described, the district will be reaching out to you and having conversations over possibly some additional options that may be available at that time.
Thank you. And just to add to that, and you could stay on this slide, Kevin, this is fine. Our ESL students, I'm sorry, I meant the slide that you were on. Thank you.
Okay.
Our ESL students would also receive their services, whether they're in person or distance learning, that we would make that happen if they were ESL students receiving ESL services. Okay, lots of consternation around the program choices for the fall. And so I want to be clear, Danbury Public Schools' position is that we too want to start in hybrid learning, similar to some of the other comments that were made earlier. The hybrid model is the best for Danbury, and we are striving to get permission to do that. In the absence of having that permission at this very moment, and we've got some folks who are working on that. We've got our legislators who are working very hard on our side, the mayor, Dr. Sal, and cabinet, and lots of folks. In the absence of that, we are still required to offer right now, currently, 5 days a week in school learning. And so the choices currently are based on that premise, that we have to offer an in-school experience 5 days or distance learning option. There is always, of course, the homeschooling option, which you see on the screen. But in terms of the bigger choices that families are making, most families are making the choice between in-school and distance learning. Now, should the state grant us permission to enter in a hybrid model, then we will be able to have folks edit their choices and to update their selections. And of course, if there's any changes in that would change, that would be way heavily in the way that parents would want to make choices. We would allow, of course, for families to make those updates and to make those adjustments. But you have to understand something within this. Our distance learning plan and what we're able to offer is based on the number of staffing that we have available, the number of students who select that option. It's a little bit of a chicken or the egg situation here, because many parents want to know exactly what it looks like in order to make a clear and informed choice. We need to know kind of what our pieces are as well, so that we can put together the best plan possible. So I will explain a little bit something about the distance learning and a program called Edgenuity at the secondary level. And I want to clear up a couple of misconceptions about that. And some of that may have been a result of the way things were captured or phrased in the survey to you. And it is also part of evolving information that we are learning as we are working with the company to understand more about some of the programmatic features that we have access to. And so in the nutshell, Edgenuity is not a third party that we would send kids off to be educated with, I'm sorry. Edgenuity is a curricular platform, and there is a resource for teachers to use in class to support teaching and learning in a digital environment. The courses can be aligned very closely to our DPS curriculum. They can be customized. And so all teachers at the 612 level in the core areas, mainly the core areas, would have access. The students will be enrolled in those courses, and students will get used to using materials and digital content from that resource. There is an option within Edgenuity to have more of a self-paced course, which we were considering very closely. However, there are some technical issues that we're working through. At the end of the day, a DPS teacher will still be working with your child in distance learning, whether it is in the fall cohort or if the district should switch over. And we're working out the details behind that. So there'll still be contact with the DPS teacher. We do have issues around certification that we're trying to work through and what that looks like at the secondary level. And so, but students, their experience would be different than if the district converted over to the whole district in distance learning, where the teachers are largely available to work asynchronously and synchronously with the entire class. So more information will be coming out about that. But I just want to be clear that students who would participate in the distance learning in the fall cohort would still likely have contact with their teachers, but would be working more independently and have a little bit less contact than students who are in the class, obviously in person in school. Okay. I know that's a lot to absorb. There's a lot of questions around, will I be able to change my decision once I make it, once more information becomes available? And what we want parents to understand is that we will be staffing and trying to, creating bus routes and transportation to make sure that we're adequately servicing kids who select the different options. And so changing over very quickly and coming in and out of those options is not easily done. Certainly we could work with parents to make those things possible if needed, but they wouldn't be instantaneous. They would have to occur at certain breaks where we have time to adjust and redeploy. So I know that was a big concern with folks. So your choices for the fall that you had an opportunity to see were the in-school, again, traditional schedules, maintaining blended and learning connections. Some traditional schedules in the sense that the teachers see students 5 days a week, but some of those schedules will be adjusted so that and possible some early releases, which you'll see in the next page. The homeschooling option, which is always an option, and we can work with families who select that a little bit more closely to explain what it is that they need to do. And again, the distance learning at the K-5 level, I didn't speak too much about the K-5. We would likely have our own DPS teachers working, creating a virtual classroom. This could potentially mean that your child is not necessarily assigned to a school per se, but rather a teacher who will be teaching grade 2 or grade 3 course content, for example. And so we have to be able to, again, adjust these based on the number of teachers that we have available and the number of students who select the option and where those occur, which schools and which grade levels. So it's a very complex matrix of decision-making that needs to occur. Kevin, you can go. Thank you. So we have a couple of our principals at each level. We have an elementary school principal, middle school principal, and high school principal to briefly talk to you about some of the K-12 schedules and the proposed schedules that we're considering. The first one deals with the phase 1, and then the second one deals with what a hybrid schedule could look like. And we will start with the high school. Dan, are you on?
Yes, I am.
Great. Thank you.
Thanks for having me here tonight. Try to get through these schedules. And as everyone has said, I had the opportunity to sit and view this chat, and I think it's very important that the teachers and parents and even some students that are on here, that it's very important to understand that Danbury High School, Danbury public schools, everybody is pushing for the hybrid model. So what we're doing now and these schedules that are coming up are because this is what the state asked us to do. So we have been sitting with the administration and the custodians and facilities at Danbury High School and did a tour with an architect trying to find the maximum space in our rooms. We haven't got the total recommendations for them yet, but as we've come through, we're getting a good idea of how many students we could fit in each classroom. As Dr. Sal mentioned, there are many classes at Danbury High School that are over 24 students, and how and what we would do with that is what we're working on now. So we're going to go through the 3 phases. There will be some, or 2 phases. There'll be some adjusting. Go ahead, Kevin. Adjusting. This is the first phase that we came with, and the big thing that you'll notice is while we start on time at 7:05 and 7:20, that no one will be dropped or allowed into the building until 7:05. Generally, we have some students that show up as early as 6:45 in the morning and get dropped off. Doors will stay locked and entry will be not allowed until 7:05 because kids will have to report straight to their classrooms. No more gathering in the cafeteria or open spaces. We can't have that. The big change is that we're out an hour and a half early every day at 12:30. Now, why do we have to do that? because there is no way for us to serve our lunches. Our cafeteria was the first thing that we tackled, measured, and found that we cannot service our 4 lunch waves in there. So at 12:30, we can do what we're referring to as a grab and go lunch from different kiosks around where we have the buses, and we're looking to dismiss, certain waves or areas of the building at a time, go down, grab your lunch, and go and get on the bus and eat it when you get home. 12:30, is late in the day. It's, almost 5, it's 5 hours later or something eating. So, we would encourage kids to bring snacks and things like that. But then when they get home after 1 o'clock to 1:55, it's independent practice time. This allows teachers to, get in contact with students that weren't there. Gives teachers the opportunity to work on some DL stuff with their colleagues that we have part of too. Kevin, you want to go next one? This one is the in-person modified. So we would divide our DHS up. We are still discussing how to do that, but we are leaning towards, dividing it by alphabet, taking A through K and L through Z, and making a group 1 and a group 2. Reasons for that is it allows families to go to school at the same time. And we think that's the best model that we can work for. Doing that with Wednesdays off for everybody with synchronous learning with their teachers. This gives a lot of time for office hours and things like that. But with this model right here, I feel very secure and safe that we can get all of our students into the building and maintain safe distances. While I think we'll get a good handle on the classrooms, I don't think we're going to be able to manage a 6-foot or even 3-foot distance in our hallways. We've been working with the architect and making, looking at our stair towers, up and down stair towers. We did not go with one-way hallways because it was too difficult. But what we did with the towers going up and down is that it almost makes one-way hallways as you come through. It will take some extra time for students to figure this out, especially our 9th graders. We will be looking to do small group something or other to have tours or put something out just to, not only our freshmen coming in as their introduction to Danbury High School, but even our 10th, 11th, and 12th graders. This is going to be a whole new traffic pattern to them. We've been working very hard on it. I believe we'll continue, and by the time we're done, we'll have it pretty much mapped out within a week or so.
Thank you, Dan. Dr. Zulita?
Yes, thank you. Dan did such a great job at explaining it. If you go to the next slide. Our schedules, the student schedule is very similar to the high school with the time shifting, and we have worked together to make sure that there's enough bus run time in between. So you're looking now at 2 schedules, one for Rogers Park, Broadview, and West Side, and then one for our Endeavor Academy. So students, it's a shift in our time that students come in. Usually kids are dropped off at 7:25, and from 7:25 to 7:40, they're coming in, they get their breakfast, they're kind of milling around. It's going to be different. So they're going to be dropped off between 7:35 and 7:50. There will not be a breakfast. It's going to be a grab and go kind of kiosk as they walk up specific stairwells, 3 to 6 feet apart, and they go directly into their first class, which is their team enrichment class. And so there will not be any congregating. There will not be anybody in the cafeteria. They're going to go right into their classrooms for a very simple breakfast. The learning piece will occur between 7:50 and 12:50. We're still looking at our rotation that we have in so that all their core classes are seen. We're looking at a 45-minute core class, a 30-minute elective class each day. And so the kids will continue to maintain what we're used to doing in class now. At the dismissal, that'll be at 12:50, and we'll start with probably our parent pickups and our walkers, and they'll be dismissed again, 3 to 6 feet apart, walking down specific hallways. It's going to be very different between the 3 buildings. We have different layouts. West Side only has 1 floor. And so it's going to be us going in, mapping out. When I walked with the architects at Rogers Park, we talked about the 2-way traffic, but there's got to be places where you can't go both ways. And so we decided just a 1-way around, but we're able to get 2 lines of kids walking in one direction. But also in the classrooms, I know we didn't see any middle school classrooms pictures, but I did with the architect kind of laid out a science room. We have a lot of tables across the three buildings. We don't have a lot of single desks typically. And so we were able to kind of just space out our desks where the kids were kind of sitting. Ours was at 6 feet at that point, but I know that they're working on the 3 and 4 foot apart. But students will be facing forward, masked, 3 to 6 feet apart. There's not going to be a lot of interaction and small group work like that. So just so that people understand that this is going to be different than what we are normally doing with all of our collaborative work because of the safety of the students and for the teachers. We are working on figuring out how to grab and go lunch. So students will be picking up their lunch as they exit the building. They're not allowed to eat it on the bus. But they will have that for when they get home. And then, like Dan said, we'll be expecting our students to continue independent practice in the afternoon. And our teachers, they're still using the familiar IXL that they have and RAS Kids for some of our ESL students. And so teachers will be able to monitor that live in the afternoon and answer questions. And Endeavor's the same kind of setup. Their times are just a little bit different. Sorry, go ahead, Carl. So our modified hybrid, which is, again, I want to echo what Dan said, is our preferred. We are, each of the middle schools is over 1,000 students. West Side will be at 750. That school, remember, was an intermediate school. It's not made for giant children. And so the more we pack in there, the harder it's going to be to socially distance them. So we also, like everybody else has said on this meeting, prefer the hybrid. And so ours would look very similar to what Dan had said. Is, again, the times are different. With the group A in 2 days, everybody home, group B comes in 2 days. We had discussed some different ways of getting everybody in cohorting, thinking about addresses, knowing that not all families have the same last name. And so we did talk about, in some of our small groups, looking at address, the cohorting, maybe thinking that the busing routes might be easier that way. And Endeavor, again, same, just the times are a little bit different. Thank you.
Thank you, Kristen. Dr. Hislop, on behalf of the elementary schools.
So Dr. Hislop able to attend.
Oh, thank you, Principal Mashal.
So this is Principal Mashal. I am the principal at Shelter Rock. Myself, Tina Hislop, who is the the principal at King Street, and Lenny Serlich, who is on with me as well, the principal of Stadley Ruff, were kind of put in charge of the elementary schedule, which is quite a challenge, as you can imagine, given the differences in building sizes, layouts of buildings, and so forth. So our 5-day in-school schedule looks like, as you see in front of you there, the 8:05 to 8:25 is for the early schools. Students arrive, they grab and go there and get their breakfast. They attend their learning. Their in-person learning also includes their special area class. So they would still, receive art, music, PE, and media. At the conclusion of the day, they would grab and go lunch. We have addressed our concerns with, our younger population waiting so long to have their lunch. So we are looking into providing them a midday substantial snack to hold them over until they get their lunch and then travel home. The teachers would stay in the building and they would offer independent practice and support our distance learners. And for our late elementary schools, we would run the same type of schedule, except they would obviously start half hour later. I think what is really important when we think about the elementary schools is that we are planning on utilizing all of our entrances to try to appropriately keep the children as apart as we can. We've also had some discussions about staggering the parent drop-off as well as the parent pickup, so it doesn't interfere with traffic, as we anticipate there will be a lot more families who are electing to drop their children off at school rather than taking the bus. And I think if you go to the hybrid model, I think what's important to know too about the elementary school is our grab and go decision comes from, I know Stadley Ruff, Shelter Rock, we have an excess of 500 children, which makes cafeteria challenges, recess challenges extremely difficult. The grab and go provides us the opportunity to provide our children with a safe environment, as well as providing them their breakfast as well as their lunch. So we are very much in favor, as well as the modified hybrid schedule with the AB day. We are also looking into grouping our children by families in terms of siblings. So all of a particular family would go on the A day, and that would be Monday, Tuesday, Wednesday. Teacher support the distance learning. They also will provide lessons for the students live. And then our second half of the building comes in on Thursdays and Fridays. So they do receive the full day. They're still getting all of their core subjects, and we are still able to provide them with the opportunity for breakfast and lunch.
The specials would be in their classrooms, right?
Specials are in their classroom. So we would have art on a cart, music on a cart. The PE teacher would push into the classroom. We are also working closely with our custodial staff in terms of making sure that the rooms are free and clear of extraneous kind of materials. So administrators are coordinating with custodial staff as well as teachers who need to come in and kind of remove some of those items that may be personal items. So that also allows us to ensure the safety of the children in the classroom environment.
Thank you, Anna.
Next section.
Kevin, just
So
quickly,
Kelly,
yep. Before we move on to the calendar and training support, just a comment on preschool regarding the schedules. We are currently still in the process of working out preschool and allowing us to alter some of the ending times for the K-12 level. It does present a little bit of a challenge with preschool that we're working through. And so we will certainly be in contact with those families regarding the exact times for those sessions. Just to note too, on the proposed schedules that we did show you, please just note for parents and community members that those times are tentative. They are not written in stone yet. We are working out some of the details to make sure we have enough time to get our buses, safely and securely from one level to the next and cleaned appropriately. But that will give you a general idea or sense of what the anticipated schedule for the fall does look like.
Kelly, Granville should be ready, right?
Yes, that's correct. And Granville is our new preschool location, and we are expecting to open that up at the end of August.
Thank you.
Yep.
thanks, Kelly.
You could just go to the next slide. Okay. So on this slide, you will see that part of our reopening plan has been staff training, and that has been a critical component of our plan. I'd like to just start by reminding you earlier in the presentation that we are proposing that we go with the state's waiver for 177 school days for children, which would give the district 3 additional staff training days. And that would mean that our first day of school would be pushed back until September 1st for students. So staff would still start on their first day, which was proposed by the district, which I believe was August 20th. And then we would get those 3 additional days to do much of the training that I'm going to outline. It would not affect the last day of school, as 177 student days would be what would be required per the state waiver. Part of our training is going to be broken down into a couple of different components or buckets. The first is regarding curriculum. As Dr. Casimiro had talked about, we are trying to invest in different digital supports to help students to learn both in our hybrid and our distance learning models. And one of our efforts in the fall will be to how to train students and staff of how to best use those models when we have them in front of us and early in the school year. We noticed that that was a challenge as we transitioned to distance learning. And so one of the things we would do with those additional days at the beginning of the year for staff would be to train them in things like Ingenuity and other programs and software that we're using to supplement instruction for kids. The next bucket would be on social emotional. We've broken that down into a couple different components. The first is social and emotional for staff. We are concerned about staff. Our staff members have been through a lot through this distance learning. They worked extremely hard. Some of them have endured personal situations, family matters, and we want to make sure that they take care of themselves first. And so we will be doing a series of trainings for our administrative team, our teacher team, our paraeducators, and others across the district in looking at their own well-being and emotional well-being. And so that will be done through our Cigna plan. And we'll also be reminding, as Kim Thompson had spoken about earlier, of all the resources that are available through our insurance carrier Cigna, which is the EAP program, and other online resources for staff. The next bucket will be looking at social emotional supports for kids. We know that this situation that has happened has caused a lot of trauma for kids. It was a sudden stop and closure of schools. There has been less connectedness with their teachers, their school communities, their friends, their family members. And so we'll be looking at a series of training on trauma-informed instruction. And what that looks at is making all of our staff that are working with children aware of what this time. Trauma can come in many different forms. It could be related to COVID or other situations, and we want to make sure that teachers are prepared on how to deal with that. So additional staff training in that area will be provided at the beginning of the year. We'll also be talking about social emotional learning and how to infuse different activities and lessons to build on the school climate and restorative practices work that the district has done over the last few years, and to make sure that teachers put at the forefront connecting with their students and checking in on themselves, and also talking about ways in which our support staff, our social workers, our psychologists, our school counselors can support those efforts in the school building. Reminding people, as always, confidentiality, but particularly with regard to health, reporting, recording, record keeping, of how important it is to maintain confidential information and just bringing that awareness to people's attention. On the other side of the slide, you'll see some of the training on new policies and procedures we have to put into place, personal hygiene and etiquette, how to teach students to frequently wash their hands, to wear their masks, to maintain social distance. A lot of the things that we've previously encouraged, like working in groups or being really close to a peer or friend, we're going to have to teach our younger children and our older kids that that's no longer acceptable in a school environment. We'll talk about physical distancing when students are walking in the halls, transitioning to the bus, and all of those things will have to be new trainings, protocols, and procedures for our staff to learn. We'll talk about screening for symptoms to make all of our staff hypervigilant about looking at students and their staff members as they're coming into school. And it's important to impress upon our families that this will be a partnership with them and making sure that they're screening their children before coming to school. We'll also talk about personal protective equipment and how to appropriately wear and dispose of that equipment, and reminding staff on little different policies, procedures regarding face masks and how we need to reinforce that throughout the school day for kids.
Thanks, Kelly.
Thank you.
Gina, for technology and connectivity and access.
Hi, everyone. Gina Jasmine, Director of Technology. Our main focus with technology and access is to support the curriculum across all models for all students. And so we have worked really hard to supply Chromebooks to all students during the spring, and we continue to do that over the summer. We'll also have a supply of Chromebooks for any new students entering the district, and through a generous state grant, we received brand new Windows machines for all students grades 9 through 12. We'll have an inventory on hand in the event that a device gets damaged or lost or stolen. Those things are bound to happen. So we will have an inventory on hand so we can replace devices. The district will provide a model for which all students can transport their devices to and from school safely, and be able to basically pick up, and if we have to have a sudden school closure, they will have a device with them. I'm really excited because the district is, currently working to procure wireless access, internet access to all families. And we think we've come up with a solution where students will be able to sign out a device and they will be able to have some internet access to continue their learning. And of course, we're going to develop protocols for the frequent cleaning of devices.
Thank you, Gina. And so back to Kelly, our Director of Pupil Services, Social Emotional Support.
Thank you. So just to piggyback on what I just said a moment ago, and I apologize for revisiting the same topic, really just impressing upon the social emotional supports again for students, particular to the planning at each building. We will make sure that all staff are establishing that positive, safe, and supporting learning environment. We know that that is something we always strive to do, but particularly for students that have been out of school now for 5 months, that's going to be that much more critical. We're also going to address topics and have further dialogue, further instruction, further reading and exposure to books regarding race, equity, and bias, and bringing about the importance of these topics, particularly in our world and surroundings today. In each school, we will develop a plan of how we plan to check in with individual students and follow up with them on an ongoing basis for any students that may be displaying signs and symptoms that they need some additional adult support. We want every kid to have at least one, if not more, trusted adult in the building in which they can go to and seek support if it has something to do, something that's bothering them. We have seen a lot of kids that have fear around issues that are going on in society. A lot of students that are dealing with their basic needs, and struggling to have those met, and we want to make sure to address those in our plans. And lastly, just further impressing upon the training that we'll do to staff to make sure that they're able to support our kiddos in the best way possible.
Thanks, Kelly. Dr. Mead, Family School Partnerships.
Yes, I'm here. Good evening, everyone. Thank you, Kelly and Kevin. I'm Ann Mead. I'm the Director of Family School Partnerships. And if you'd like to go to the next slide, Kevin, that would be great. We have been working hard in my department to enhance the shared responsibilities between schools and family. And in doing so, we will be looking for parents to help us keep everyone healthy in the schools. We will be doing some heightened communication to understand the new policies and protocols that our health department will be putting in place. And in doing so, we will be enacting a family school reopening agreement that we will expect every family to read and to adhere to as we reopen schools. This is for protection for our students, our community, our teachers, and all of the staff in the school. If we all do our part, we'll be able to keep healthy. Many people have asked about looking at the schools and visiting the schools. That is something that is always near and dear to our heart, having an open door policy. Though to keep our buildings clean and safe, and cut down on any chance of transmission of anything, we will be doing videos to show you the changes in the building. And schools will be doing some Zoom meeting or Google Meet for orientation for incoming children to their classroom. Along with that, we'll also be doing more training for parents to better understand how to facilitate their children's learning, how to navigate the technology we have, how just to be more supportive in a distance learning model and understanding that new technology. And then the next slide. Many questions have come up about our extended learning program. This is our before and after school program. Yes, we will be open. We are now taking registrations. You can call the ELP office at 203-797-4733 or go online at the Danbury Public School website under Family and Community. There's the forms there you can fill out. You can send them in with a payment listed on the form or call the number that I just gave you to visit our 49 Osborne Street building to pay and to submit your registration forms. We are not giving a total start date yet because we want to see exactly where students will be and how we're best going to be able to meet families' needs. So that's for the before and after school program. Dr. Sal has asked me to look into the possibility of running some full day programs off-site from the schools. So therefore I am looking at 2 different buildings and looking for proposals that we would be able to run a 7:30 to 5:30 program for families, especially if we're in an AB model. It would give parents the opportunity to enroll for a fee, their children to be able to have recreational activities, learning. We would support their distance learning while they are there, but it would also provide care for
families while they're working. And we will continue to, for my department, to encourage the use of community resources, food trucks, Connecticut Food Bank. August 5th, there is an upcoming food truck at Rogers Park. It's 8 o'clock in the morning. Please visit our webpage on Family and Communities for community resources, because we want to make sure families are getting what they need. And I will now turn this over to Chip South. Thank you.
Thanks, Ann. Chip, Athletic Director, Chip Salvestrini.
Good evening, everyone. I'm the Director of Athletics, and my name is Chip Salvestrini, as Kevin said. Want to thank the administration and all the members of this committee. As you can see, there's been a lot of work put into this. About athletics and extracurricular activities, we are monitoring the guidance from the CIAC. For those who don't know the CIAC is the governing body of Connecticut high school athletics. They are an arm of the state education system. So we are what's called education-based athletics. And we follow, as I mentioned, we follow those guidelines to the T. The CIAC has allowed athletic programs across the state to implement a phased-in approach for participation in activities in athletics. It started on July 6th. Actually, we're averaging about 350 athletes a week in our program. The athletes are all screened by coaches and our athletic training staff. We've had very good success. Kelly mentioned about the kids missing things. There has been a tremendous upbeat atmosphere at the high school with the kids just coming in for 3 hours a week. Our programming is outside. We don't use the buildings just yet. The athletes train in cohorts of 10, and that'll remain the same until we are waiting for additional guidance from the state to begin the next phase of programming, which would be around August 2nd or August 3rd. The anticipation from the state of Connecticut is that we're going to have a sports program. We would love to have the kids back in the high school at the hybrid, having a taste of having the kids in the building again. Our programming is set up to run as we normally would. You would see different things, of course. We are continuing, ongoing, and establishing procedures and a process to sanitize shared equipment. We're working with the state on that. One of the things you need to know as parents moving forward, school field trips are going to be canceled for at least the first 6 months until we figure out how we're going to measure those for safety and all those things. We're asking for visual trips to be encouraged by our teachers. And for those students who are going to do distance learning, they still can participate in extracurricular activities. I just want to point out that if you choose parents as a home school and you decide that you want to participate in sports, that can't happen. You have to be in distance learning, enrolled in a school district in order to participate in a CIAC programming. Thank you very much, Kevin. That's it for now.
Thank you, Chip. Dr. Sal?
Yes.
Closing thoughts?
Well, this has been long, and I'm going to turn it over. I appreciate all the hard work that's gone in, and it will be going even further. The elementary principals who are short in the year will be coming back. We've just sent something out to them so they could spend the detailed time within their own buildings to develop individual schedules. So all of that is working. I'm glad you reiterated that if some choices needed to be edited, and we have some advice from the state, and parents want to make another choice, we will open it up to allow those parents to make those adjustments. So with that, Gladys, I'm going to turn it over to you. And I thank everybody for their diligence in listening to us. It has been a very long summer, and I think we've planned it as best we can for our youngsters. So thank you.
Thank you, Dr. Sal. On behalf of the board, I just would like to thank our mayor and everyone that's listening to the presentation. We know that you're working hard. We can hear it and we can see it. We want to thank our council members and everyone that's on the phone, and most of all, board members that have listened to the presentation before this one. And I just want to thank you. And our delegation, we want to thank you and hopefully that we will stay in contact, and that, everyone has said that we support the hybrid model, and that's what Dr. Sayre has sent forth. And I hope that you somehow can put it into our governor head that this will be the best fit for Danbury. And on that, I would just like to close and thank everyone for listening tonight. Thank you.
So if people have questions, obviously bring them to us. I'm sure that as soon as I have some information, I will get it to the board, particularly about that health issue that Mark discussed with us this morning. When they construct that letter, I'll share it with you, and we'll attach that to our plan on Friday. So thank you very much.
Good night.